So welcome back to the latest episode of Taking Charge of My Cancer podcast. And I have an amazing guest today, Natalie Horback. So Natalie is a physician assistant working in Breast Medical Oncology. She's original from Miami, Florida, and now she lives in Tampa. She graduated undergrad school from the University of Florida with a major in Applied Physiology and Kinesiology. She worked in Obstetrics and Gynecology as a medical assistant prior to applying to PA school. Then she attended the Wake Forest School of Medicine, PA studies, and graduated in May of 2023. She officially started working as a PA in Breast Oncology in August 2023, and she has been loving it since. So Natalie, thank you so much for doing this with me today.
Absolutely. It's so nice to see you, Darlie. It's been a couple years. I feel like
Actually,
I'm grown up now.
Exactly. So I'm so excited about this episode because actually Natalie and I went back a few years back when she was here undergrad at UF and she was my APK intern. And she did an amazing internship, but I think that that was your first time being exposed to oncology was here with me. And look at her. Yes, we kind of fit that little, my goal in life is to put seats on all my students in oncology. And here you are. So PA and now working at Moffitt and oncology. So it's so nice to see that little seat. And now you're really part of our community and helping these patients with cancer diagnosed that is such a great, rewarding place to be in so many ways. So many ways, sometimes it's sad, but definitely it is very rewarding for the most part. So thank you so much again. I just was so excited to know that, oh my God, I'm gonna get to interview her and I haven't seen you in a few years. And it's nice to see you now as a professional and working as a colleague. So that's amazing.
No, absolutely. You definitely did plant that seed. That's where I found my first spark and interest in breast oncology. So I always related back to you, Darlie, as my preceptor back in undergrad at UF and getting exposed to that. And you were so encouraging and so inspirational. So I owe a lot of that to you. But I know we have a full podcast to talk about me and you and this career. So I'm really feel really lucky to be chatting with you today. Now here, a couple years later, and fast forward, who would have thought I'd be in this position?
Exactly.
I didn't think so, but here we are.
Yeah, right. A small world. So tell us about your role. And we kind of already touched base if you always were planning to do this, but tell us a little bit about your inspiration to become a PA and doing what you're doing now.
No, absolutely. So back in undergrad, I wanted to originally be a physical therapist, and that's why I did applied physiology and kinesiology. I was a dancer my whole life, so I loved movement, the body, and I also loved helping people. And science just really always made a good amount of sense to me. And I'm like, well, those two together sounds a lot like physical therapy. And I was going through my undergraduate education. And honestly, not until my senior year when I had finished all my prerequisites and I was with Durley in my internship, did I get exposed to a little bit more of the clinical side. I know during that internship, not only were we working with patients in the rehabilitation setting, but going to tumor board conferences and just hearing these patients' stories and being exposed to all the different types of medicine with the surgeons, the medical oncologists, the radiation oncologists. I look forward to those tumor board conferences with you every week. And I had never felt inspired in that way, throughout my graduate education yet until that moment. And I remember sitting there thinking, I think this is what I want to do. I think this is where I see myself in the future. And this is what is making me want to learn more and more. And I actually ended up going to PA school since I had heard about the career and I knew I wanted to get into the oncology setting and really have that continuity of care with patients. And I applied to PA school, went to Wake Forest in North Carolina, and was there for 2 years, and it was an amazing program. And I found myself just thinking about how much I loved oncology, and I did a bunch of different rotations, and my favorite one was again oncology, and more so just the patients and the relationship building, and the patients are just the whole reason why I do it. And I was lucky to get a job at Moffitt Cancer Center working in breast medical oncology. And I've been here about 1 year out of PA school, and it's been an absolutely rewarding and amazing experience. So yes, Darla, you did plant the seed, and I feel like I'm growing. I'm not fully grown yet, but on my way there.
So great. That's so great. So based on what you have learned in these past, 3 years, because only learn oncology, maybe even more than that, if you have to pick three valuable tips for patients who are being diagnosed with cancer, I know you're doing breast cancer right now, but in general cancer, what will be those?
One, what I would say is something that I've learned just throughout patient care is outlook and motivation. I think some of the patients that we work with that really try to have an optimistic outlook and are really motivated for treatment. Just trying to remember that, your providers are there along with you. If you have a positive attitude towards it, kind of implements your energy level and your motivation to get through treatments. So trying to really, try to be motivated throughout the treatment is one tip that I would say. Second, I would say ask the questions. Don't be afraid to ask questions. No question is a silly question. I'd rather, that's going to help you understand your diagnosis, and even bringing a friend, a family member, a partner to your visits to help ask questions or be a second ear is always helpful for you to understand your diagnosis and to feel confident in your treatment. And three, I would say not to Google too much about diagnosis, because the internet has some accurate things and a lot of inaccurate information, and not to circle, back and forth on things that may be scary or sound daunting to you. And I would ask your medical providers, but those are probably three tips I would provide.
That's a very good tip, and I like the idea of the Google quite a bit.
Mhm.
Like right now, it's a lot of things are, AI and Google and all those things that are can be some really good things, but just make sure that as a patient or family member, just make sure that you really look into valid websites, like, medical-based websites. There's so many really great things in SIH and so many good things to look into it for, evidence-based support
Mhm.
treatment. So that's important. And sometimes patients as well, like support groups is a great idea. And I'm all about that. But sometimes you want to be on a support group that is very uplifting, no, a
Mhm.
support group that is going to tell you all the bad things that happen. And every patient in there is going to tell the story based on their story. So if they have great outcomes and they have a really good medical team and they have really good outcomes, everything is going to be very positive. But if it's not, everything is going to be negative. And that doesn't mean that it's going to be everybody's case. So really, sometimes always just be surrounded by people that really uplift you and be positive. You don't need to be hearing negative things because that's not going to be good for you. So
Yeah, I absolutely agree with that, especially support groups that you have through, your hospital or your clinic that are mediated by someone, and having that energy kind of, monitored and making sure it's a free space, but trying to make it a positive environment to feel bonded and related to, and answering those questions, because you can go, down a deep rabbit hole on the internet, and if it's something that's negative, you kind of can change your whole mindset on your day-to-day life with it. So
exactly.
absolutely.
What type of resources would you recommend to patients to look to it as they're going through cancer treatments?
It's a good question. I would probably recommend within your medical team asking, for social work or resources that they have. As we were just talking about, we do have, different types of support groups, whether it be early stage breast cancer support groups and going through curative intent treatments and what their side effects are with other patients that are going through similar treatments. Even, there are also metastatic patient support groups that I've heard are very beneficial from patients getting to relate day-to-day activities, outcomes, and just how to cope with their diagnosis, and being able to relate to other patients on a personal level is really just, it gives you more of a support and almost like a family community. So definitely reaching out to what resources are provided per hospital setting. I know if there's more just objective information on there's the American Cancer Society, or, qualified online society, cancer research portals that you can look at online, but really just reaching out to your hospital or care practice to figure out what they have to offer. Because we do have resources for patients.
What is a common question that you find oncology patients ask you all the time, and what will be, a good information that you would like to share with us today?
So I do get a lot of questions that are kind of overlapping, but one that is very common is patients asking, well, what can I do now? Is there supplements I can take? Are there vitamins I can take? Is there food I can eat? What can I do? Because people want to be able to control what they can do in their life to, make their process go better or worse, and want to have control of their body, which is a completely normal question and motive. And I always say, really, it's taking care of yourself, making sure you're staying well hydrated, going through treatment, eating a well-balanced diet, cutting out, alcohol or any harmful substances or additional supplements, and really just trying to move your body as much as you can, listen to your body, and just take care of yourself and make sure you're putting, nutritious foods in your system and staying well hydrated, but just trying to make your body feel as healthy as possible, going through that process of treatment.
That's a very good answer. Have you heard any, or what is your opinion, or if you have heard, and I don't know if any of the medical oncologists and Moffitt, what is your opinion on fasting before chemo?
That's a good question. I haven't really discussed it as much with my providers about fasting before chemo. Usually we try to have patients, at least extremely well hydrated and having at least something in their system beforehand. But it's not something that I've actually spoken with them about.
Okay. Yeah. So has been some, I think that the first time I heard about it was one of the medical oncologists here, and that started coming from Canada, if I'm not mistaken. And a lot of functional medicine physicians start talking more about it, like how sometimes fasting is really protecting. As you fast, you're going into that keto effect in your body, which you can protect your good cells. So as chemotherapy is going to be general toxicity, right? So it's not going to go after only the cancer cells, but the good cells. It's a way to protect those good cells. And then what I have seen is a lot of less secondary effects like nausea, cancer-related fatigue. So I have had some patients who really do really well with that. So again,
Yeah.
some opportunity to explore as well with your providers. And I think that here, like some of the physicians talk about it, some of them are like, we don't have too much, evidence, like strong evidence yet, but I hear more and more and more through more like the wellness and functional medicine. So can be something to explore.
Yeah, that would be something definitely that I'd love to read into and learn more about. Our goal is always to prevent secondary side effects from the chemotherapy, whether it's having patients do cold therapy on their hands and feet, or giving IV hydration prior with pre-medication. So anything that can help with that is definitely something. Yeah, thank you for sharing that.
Absolutely. What is a painful lesion, at least like a painful situation that you have learned along the way, either as a going through PA school life or just being in the position where you are now?
Great question. Lots of lessons that I have learned. So I guess something that I always think about is within this field of oncology, as any type of provider, a nurse practitioner, PA, or MD, PT, all of us, we need to make sure that we are taking care of ourselves. Oncology is pretty heavy and taxing on, sometimes the emotional and mental health providers as much as it is on patients. And it's a privilege for us to be treating patients in this that are battling cancer, but taking time for myself and for ourselves to go on a walk, eat our lunch, debrief, however you feel is necessary after a day of having a tough discussion with a patient or having a tough clinical situation, and letting your body kind of reset and being allowed to express how you're feeling and move forward. I think I've learned that exercise has been a really great outlet for myself to kind of run it out, sweat it out, and just feel good and I feel, very lucky and grateful I get to move my body and do that. And it makes you feel grateful when you're treating patients that are in different situations. But I guess this lesson mainly is that this field is it's a very heavy field. You have a lot of responsibilities, especially as a new provider right out of PA school with a steep learning curve. You want to be able to answer all the questions. You want to be a sponge, and having to learn that it takes time to do that. And taking care of yourself is the number one priority to take care of your patients. And so giving yourself some grace, which is, I'm still working on that. I'm still working on it. But trying to give myself some grace in debriefing how I feel after the end of the day in order to be my best self for the next day.
That's awesome. I'm glad you mentioned that because sometimes, many of our patients see us as a clinicians, right? Sometimes they forget that we are human beings and we get affected, right? One
Mm-hmm.
the other way. Like one because we get excited and is happy when they improving and they have good scans and it's good news. And then we get sad as well when we have to give or for you giving bad news to the patient or for us to reiterate those bad news and try to
Mm-hmm.
explain in detail because they go to you guys and it's a lot of information coming to their brains. And then they come to us, and because we have the luxury to spend a little bit more time with them, then we
Mm-hmm.
have to really try to piece those little information in smaller parts to explain what was told to them and try to make them understand. But then sometimes, and then you don't want to show your emotions, right? How many times sometimes, yeah, I cry with a patient, and sometimes I have to hold back because this is not a good idea right now. But sometimes patients don't see that, so I think it's a nice, and sometimes they do, but many times they're just so like in tune with what's happening to them that they don't see what's happening outside themselves, and not just with us, but even with other caregivers, right? So they
Mm-hmm.
don't realize how much a caregiver, a husband or a wife, or even the kids are going through, and it's scary for them seeing mom or dad dealing with a cancer diagnosis. So I think it's important for, like you say, for us to take care of ourselves because we preach exercise, we preach good nutrition, we preach good sleep, and how many of us actually do that, right? So you're absolutely right. Like I tend to be very, as you know me, I have to, it's my lunchtime is my exercise workout routine. That is my own time. I don't exist at that time. It's like, I need to get myself into like again all that energy and just kind of get myself into that. It's my caffeine for the rest of the day. I always call it. It just make me feel better. Energy, my mind clears, if I feel frustrated or sad or something that kind of make me feel better. So I think it's important, like it's always a time to do it. And if you just get yourself in a routine, no matter if it's lunchtime or first thing in the morning, at the end of the day, whatever you can, but getting those like loving me time for like at least
Mm-hmm.
30 minutes or whatever you need to is very important for your own health. So thank you.
Absolutely. Yeah, I think that it's something that's still a learning process. We work very hard because we want to do what's best for our patients and we want to be the best providers. And especially as a new PA, there's so much more to learn, there's so much more to do, and trying to take that time is, something that is a priority, and to just get some, sweat a little bit, walk outside, feel the, fresh air. But yeah, still working on it.
Perfect, perfect. Um, what that means to advocate for yourself and how can people do that?
So advocating for yourself as a patient is something that I had alluded to beforehand, is I think asking the questions and making sure that you don't feel scared to continue to ask for a test or ask for a question in order to clarify something. I've had, multiple patients, not just in my job now, but in just throughout my PA school education that are asking because they feel that something is off. They feel a lump in their breast, and they've gone to an outside provider at some point and was told that, let's wait on it, or didn't order any imaging on it. And the patients sometimes are not able to get the appropriate imaging on something that could help them have an earlier diagnosis. And I've had patients speak to me and say that they asked for a mammogram or they asked for the breast ultrasound for reassurance, and luckily had ended up catching an early stage breast cancer. So just making sure that if you feel that something is off and you're, not satisfied with no further investigation, making sure that you're just advocating for yourself and explaining how you feel and having that open communication with your provider, whether it's for reassurance to make sure that you can move forward, knowing that it's something benign, but just making sure you ask those questions and make sure that you feel comfortable and confident moving forward.
And I want to add to that as well. And I always tell my patients, if you don't feel comfortable with your provider, find a second opinion. It is nothing wrong with that. You're not going to offend anybody. Well, some providers may get offended, which every time I hear that is like, that will be not a good provider for you. I think a good provider will never be offended for you to get a second opinion, because
100%.
those are the ones who wants to get the best, and can be as simple as chemistry, right? You may just don't feel that is the right personality for you, and you feel that you cannot trust that person. So it's nothing wrong for you to, to go on, and then don't rush. Sometimes, yes, people get a cancer diagnosis and we feel like, oh my God, I need to have surgery tomorrow, right? But you don't have to, right? So again, you don't want to be waiting a year, but you don't have to be rushing into a decision. So, it's plenty of time to make the right decision and feel comfortable. So don't ever feel bad saying, I really don't like how you're talking to me, or just can I see another provider that works with you, just because, I just don't feel we are kind of really having a good personality match. And that's okay. So
Yep, absolutely.
how can people find you?
People can find me I do have a LinkedIn, and my name is Natalie Horback. So that has just, my prior experience, and just my contact information.
Excellent. Or they can go into Moffitt, right?
It should be on the Moffitt website as well.
Exactly. And I will have the notes on the podcast, show notes as well, so people can do that. What is your advice in regards how can patients improve their outcome while they're going through chemotherapy? And you kind of already mentioned a little bit of that.
Yeah, we kind of talked a little bit upon it. Again, I'm a huge advocate for listening to your body, and especially for patients, since I'm on the medical oncology side, going through treatment, immunotherapy, chemotherapy, or targeted therapy. Um, Making sure if you have a question after your treatment, or you're feeling, the side effects to expect, but you're feeling really weak, or you're feeling really more fatigued than you should, or you're questioning, are these side effects normal? Is this something that I should be going to an urgent care for or seeing another doctor for? I just say to reach out, to call your providers, and there are treatments for these side effects, whether it's nausea, whether it's significant diarrhea, or a skin rash after a treatment. Making sure not to just wait until your next visit to talk to your provider about what happened, because chemotherapy does have side effects that can be managed after, if we give you the right treatment and preventative medication. So just making sure to listen. And if you feel that something is a little bit more intense than what you were told or discussed with your doctor, or you're unsure, there's no harm in calling and reaching out, instead of just trying to wait it out, or going to a local urgent care, or another primary care provider. Just trying to reach out to your team if you have the means to.
How much is the clinic referred to PT during chemotherapy?
That's a good question. I am a huge PT advocate. I actually talk to my patients all the time about how I did my internship with you and how important of a role physical therapy is, especially in breast oncology. Because if you don't use it, you lose it with your range of motion of both your, your axilla and your arms. And I see it day in and day out. And so I really try to implement physical therapy as soon as possible. I know our radiation team and our breast surgical oncology team refer them, even before sometimes treatment and radiation and after. And I see them pretty often every 6 months after treatment. And so we're always talking about that. And even I tell them a few of the exercises and stretches, range of motion activities to implement, and even refer them locally to PT and OT near them, but really thinking about how important that is because it affects posture, it affects mobility, quality of life, lymphedema, and so I definitely we do implement it a lot as well.
Okay. That's great. And I'm glad that's kind of what I want us to really, we went from 15 years ago when I started doing oncology, was a lot of the time where patients were told, take it easy, right? Don't do anything strenuous. No, no, you cannot go back to work. No, no, don't be in public. Just stay at home and do nothing. And now it's like the opposite. We know that exercise enhances chemotherapy and radiation. We know that the more active you are and the more busy you are with your normal life, the better, you're going to feel during those treatments and some of those side effects. So again, just try to really encourage patients to just move and not just take it easy. Of course, if you're having your blood counts all the way down and you're neutropenic or something is really happening because as a reaction of chemo, of course, right? But besides that, let's really encourage to kind of really go for exercise. And it's not just like a just take it easy exercise. It's really on a high level when you can really make a difference on your heart rate and the strength training. So that's important. So I'm kind of glad that you're helping them implement that because I see so many times I don't see that from the medical oncology standpoint. So we see a lot of the referrals happening when the patient is already in trouble versus before the patient gets into trouble. So it just kind of really try to be more proactive and hopefully avoid or try to diminish some of those side effects.
No, absolutely. And that's a learning point that I've carried with me that I learned from you and from my internship and seeing lymphedema as often as I do, it's always in my head and it's always in my mind. And that's always one of my main questions. Even in my 6 month follow-ups, are you doing physical therapy? Have you done it? Or just how active are you? And I check their range of motion. So it's always in my head, and I think that it was a blessing that I have that as well. And I do mention to them that in my internship, I was like, I learned I even wore a lymphedema sleeve garment for about 24, 48 hours so that I could relate and feel what it feels like to wear it. And, it opens up the rapport with patients and we talk about it. But a huge learning experience and things that I keep in the back of my head.
Excellent. Very good. Is any one question you wish I will have asked you and what you have answered before we wrap up?
I was gonna say, I guess what's my favorite part about working in breast oncology? And I was gonna say that my answer would be that it's the relationships you build with patients. A huge actually factor in my motivation to go into breast oncology was during my internship with Durley at UF. My mother was actually diagnosed with breast cancer ironically in the middle of my education about breast oncology in the PT clinic. So it was really, shocking to learn that. And Durley was a wonderful support and everyone at UF just kind of educating me on, I already had all this new information about breast cancer I had never known before. So I was able to really understand my mother's diagnosis and be with her through chemotherapy, radiation therapy, her surgery. And that also fueled my motivation and inspiration to work in this field. But being a part of her life, and supporting her and seeing the patient side of things, I just really value that connection and relationship you build with your patients, and being able to have continuity of care, and hearing about patients' brother's wedding and their new pet and hearing about their life. It's such a privilege as for us as medical providers to be able to be a part of someone's life and help them in any way. So I think I owe a lot to, that internship way back a few years ago, and then ironically my mother's experience. But so I'm really happy to be working in this field, and it's been an amazing experience so far.
That's amazing. How is she doing?
She's doing amazing. She's doing wonderful.
Well,
She is, back working, doing her, everything she would do before. I'm still on her about doing her physical therapy and moving her arms. So she, I'm might be a little bit overbearing and monitoring her, but she is doing wonderful. Thank you for asking.
absolutely. I'm so glad. Yes. And again, sometimes things happen for a reason, and sometimes it's for right reasons. And I really believe that when things mean to be for you, things mean to be for you. And then again, you just end up here and getting exposed to this, and then your mom, and look,
Mm.
I'm sure you'll do amazing. And I know we're gonna continue being in touch, and we'll
Mhm.
refer patients to your way, and then you'll do awesome. So, well,
Yes.
thank you so much for doing this. I really enjoyed this conversation. I'll appreciate it.
Yes, thank you so much for having me, and I hope to see you soon.
Absolutely. You take care. Have a great evening.
You too.